Sunlight BonAge, the only ultrasound-based BonAge testing device available anywhere. Radiation-free, accurate, and objective. It's the natural choice for BonAge assessment with on-the-spot results in the physician's office. To measure with BonAge, we need the BonAge main unit, which is a PC unit with dedicated software and user interface, the BonAge measurement unit, the BonAge measurement gauge, a skin marker, and ultrasound gel. Children aged 5 to 18 may be measured with BonAge to diagnose or monitor actual or suspected growth abnormalities, or to track normal growth and development. Before measuring a patient for BonAge, the operator seats the patient at a comfortable height and opens a patient file for the patient. Patient details are added, especially all mandatory fields, including age and height. Before starting, the operator clicks the Home button in the motion control section of the measurement screen. Then, the operator places the patient's arm in the measurement unit, with the upper arm at a 45-degree angle from the lower arm. The fingers of the patient's hand should be resting gently on the cylinder at the end of the armrest. Next, the operator marks the measurement site. She feels for the head of the ulna, a bony protrusion on top of the outer side of the wrist. She then places the gauge over the head of the ulna, using the circle of the gauge, which best fits the size of the head of the ulna. She draws a vertical line in the center of the circle, using the lines on the gauge to guide her. The operator now adjusts the position of the transducers to the patient's arm. She presses the XY switches on the measurement unit, or the movement buttons on the measurement screen, until the midline, marked on the top of each transducer, is precisely aligned with the vertical line of the skin mark. Next, the operator applies gel to the two transducer heads. Now, the measurement is ready to start. The operator clicks the Start button on the screen or presses the Start button on the measurement unit's keypad. This will cause the probes to close on both sides of the patient's arm until pressure equals approximately 500 grams. The first ultrasound measurement of the wrist commences at this point. During measurement, the measurement process is displayed in the form of a building graph. The graph, cycle build, and cycle number, along with the green lights that show ultrasound contact, all indicate to the user that the measurement is ongoing. When each measurement cycle is complete, the graph, progress bar, cycle build, and cycle number tell the operator that the cycle is complete. Crossed flags at the left of the measurement graph in the middle of the screen also indicate the end of each cycle. When the first ultrasound measurement of the arm is complete, the device automatically opens and raises the transducers by 2 millimeters in preparation for the next measurement cycle. The operator then detaches the transducers from the skin of the patient. Next, the operator presses the Start button on the measurement unit keypad, or clicks the Next Cycle button on the screen to start the next cycle. This process is repeated until the Next Cycle button is disabled. This process can take up to 11 cycles. Now, the operator clicks the Result button to get BonAge results for the patient. In certain cases, if the software alerts you, place the BonAge measurement pillow under the patient's measured arm and remeasure. The BonAge result, along with height prediction, appears in an easy-to-read graph and a table. The results can be printed in a concise measurement report with graphic display.